The complete blood count, or CBC, is a fundamental test used to evaluate overall blood health by analyzing different components of the blood. It is essential for diagnosing conditions such as anemia, infections, and blood cancers by providing detailed information on red blood cells, white blood cells, and platelets. The test uses whole blood samples collected in EDTA tubes, which prevent clotting and preserve cellular elements for accurate analysis. Some components of the CBC is we have a white blood cell count, or a WBC. This measures the total number of white blood cells, which are essential for fighting infections and mounting immune responses. Then we have the red blood cell count, or an RBC count, which indicates the number of red blood cells which carry oxygen from the lungs to the tissues throughout the body. Hemoglobin measures the amount of hemoglobin protein in the blood, reflecting its oxygen carrying capacity. Hematocrit represents the percentage of blood volume composed of red blood cells, giving insights into blood thickness and oxygen transport capacity. The mean corpuscular volume, or the MCV, calculates the average size of red blood cells, helping classify anemias as microcytic, normocytic, or macrocytic. The mean corpuscular hemoglobin, or MCH, measures the average amount of hemoglobin per red blood cell. This is important for evaluating the quality of the red blood cells. Or the mean corpuscular hemoglobin concentration, or the MCHC, which reflects the average concentration of hemoglobin in a given volume of red cells, which is useful in diagnosing types of anemia. We have the red cell distribution width, or the RDW, which indicates the variation in red blood cell size, or anisocytosis, which can suggest mixed causes of anemia. Platelet count counts the number of platelets which are critical for blood clotting and stopping bleeding. Mean platelet volume, or the MPV, measures the average size of platelets, with larger platelets often indicating increased platelet production or activation. Then we have the white blood cell differential, which provides the percentages of different types of white blood cells, your neutrophils, lymphocytes, monocytes, eosinophils, and basophils, which offers detailed insight into immune function in potential infection or hematologic disorders. For interpretation of results, so an elevated white blood cell count may indicate infection, triggering increased white blood cell production, suggests inflammation from autoimmune or other inflammatory conditions, and could be a sign of malignancy such as leukemia or lymphoma. A low hemoglobin can indicate anemia, reducing oxygen carrying capacity. Causes include nutritional deficiencies like iron, B12, and folate, or chronic diseases or even blood loss. Abnormal red blood cell indices, so an MCV, if you have a low one, it is a microcytic potential anemia, which is often due to iron deficiency or thalassemia. For macrocytic anemias, you'll have a high MCV, which is often caused by B12 or folate deficiency, or even some certain medications. Normocytic anemia means they have normal MCV, which may result from chronic diseases, acute blood loss, or bone marrow disorders. For mean corpuscular hemoglobin and mean corpuscular hemoglobin concentration, so having a low one of either of those suggests hypochromic anemia, which is commonly seen in iron deficiency. If it is normal or high, it may be seen in other types of anemia. For red cell distribution width, so an elevated RDW indicates anisocytosis, which is a variation in red cell size, which suggests mixed anemia types or evolving anemia. Platelet count abnormalities, so we can have thrombocytopenia, which means low platelet count. So an increased risk of bleeding may result from bone marrow failure, autoimmune destruction, or medication effects. Thrombocytosis is a high platelet count, which can increase clotting risk and may be reactive in inflammation or infection, or primary for myeloproliferative disorders.